So Adrienne, my name is Corey Feist. I'm the president and co-founder of the Dr. Lorna Breen Heroes Foundation. Our foundation has worked to help advocate for the passage and now the successful signing of the Dr. Lorna Breen Healthcare Provider Protection Act. And these grants that we're here to talk about today are the first round of grants from it.
I'm very honored to be here. So my name is Dr. Adrienne Martinez Hollingsworth. I am the Associate Dean of Operations and Scholarship at Samuel Merritt University, but I also lead the Stronger Together project, which this funding has made available.
Tell me how the grant that you received has really helped you accelerate this work in supporting the well-being of your workforce.
One of the things that we've done is we've looked at how burnout well-being is experienced differently in different demographics. My challenge for the last 6 years, which is how long I've been looking at well-being, is that traditionally funding mechanisms focus on patients. But the shift to recognizing that providers can be and are patients is a really critical one. The flexibility of this funding has allowed for robust needs assessments. So for the very first time, my program of research, I can actually explicitly focus on providers now. Their mental, emotional, physical well-being, their sleep, right? Their dietary habits, how they're taking care of themselves. And that was made possible through this funding.
Your project is specifically focused on Black, Indigenous peoples of color, or BIPOC, populations of healthcare workers. Can you tell us a little bit about their unique needs and how this grant is working to serve them?
Well, statistically speaking, providers of color are more likely to come from the communities they serve. So there's a huge benefit in terms of cultural congruity, but there is also a benefit to patients because they know what the real barriers are. They know where the sidewalk is broken up and it's difficult to walk to the pharmacy. They know whether or not it's a food desert or a food swamp. They have this local awareness that allows them to deliver better, more tailored care to the patients. However, they also have been exposed to those negative social determinants of health. So we need to be very aware of their unique needs and support them for the who they are, where they are. So it's not just about recruiting these healthcare workers that reflect the communities they serve. We just need to get so much more granular about who we're trying to help, because that allows us to not only be targeted about the interventions, but we can be much smarter with the limited funds that are dedicated to this work, right? We know what isn't working. We know how hot the house fire is. But what do we do next?
What do you see as the immediate next priorities to continue the work and expand upon it?
My personal responsibility, what I own, is producing and delivering the most quality data that I can to institutionalize our wins. It's not enough that things got better in one clinic or one health system, one hospital, one school. We need to make sure that it is codified, it is law, and it is something that is an expectation and a standard, not something that we do when we're in trouble. And so that's what's next for me. Assemble the data specifically for lawmakers. And for me, that's about storytelling. It's about humanizing the numbers on the paper so that the individual who maybe isn't working in healthcare, who's in Sacramento or in Washington, is able to really get a sense of what this might mean for an individual so they can imagine what that might mean for them or someone that they care about in their family.
Tell me what it means to you to be in the inaugural class of Dr. Lorna Breen Healthcare Provider Protection Act grantees and what it's meant to your organization.
In short, it is a deep honor, and I don't want to get emotional here, but I had heard about Dr. Lorna before this award, and it was deeply touching to me because on the inside, we know that providers suffer deeply, and we also know that they are amazing, multifaceted high achievers. So I keep the image of her snowboarding in my brain, but at the same time, I know that someone that complex and giving and dedicated is at the highest risk. So I remember that for myself and for my cohort members to check in, be kind, understand that even if we're tasked with moving the needle, we ourselves are actively living that challenge of how do I take care of the me while I'm focused on the we.
Unbelievable. Adrienne, thank you.